Did you know that your skin, nails, or even your breath could reveal hidden clues about your liver's health? Liver disease is far more common than most people realize. As a health practitioner, I see it every day in the hospital, and often I can spot it the moment I walk into a patient's room. Today I'm going to show you the top 12 visible signs of liver disease, so you know exactly what to look for and when to act. Let's dive in. 1. Muehrcke's lines. Let's begin with how your nails should normally look. Healthy fingernails grow with a smooth texture and consistent color. If you run your finger over them, there shouldn't be any unusual ridges or lines apart from the natural curve of the nail. As your nail grows, it carries visible markings like injuries or stains upward, out toward the fingertip. Think of healthy nails like a smooth sheet of glass, clean, transparent, and even. Now, imagine two thin, horizontal white lines running parallel across the nail bed, not on the nail itself, but under it. These are Muehrcke's lines, and they don't move as your nails grow. That's a key difference. Think of Muehrcke's lines like painted stripes on the road. They stay fixed in place, no matter how far traffic moves forward. These lines appear because the liver isn't producing enough albumin, a type of protein that your body needs for many functions. Without enough albumin, the body struggles to balance fluids in the bloodstream, leading to changes in the appearance of the nail bed. Think of a water balloon with a slow leak. If the pressure inside the balloon drops, it starts to look deflated. Similarly, low albumin levels change the way your nail beds look. Muehrcke's lines aren't exclusive to liver disease. They can also appear when someone is malnourished, dealing with chronic illnesses, or recovering from a serious condition. However, in liver disease, the underlying problem is persistent and tied directly to the liver's failure to function properly. 2. Terry's nails. In healthy nails, the color of the nail plate reflects the blood flow beneath it. The base is pink, and the tip is slightly whiter. In Terry's nails, almost the entire nail turns white, with just a thin band of reddish pink near the tip. It's as if the nail is losing its natural tone. When the liver is damaged, blood flow to the nail bed changes, reducing its natural pink hue. This happens because the liver plays a central role in regulating blood and filtering waste. If it fails, the balance is thrown off. Imagine Terry's nail as flower bed that isn't getting enough water. It loses its vibrant colors and starts to look pale. Terry's nails are often a sign of advanced liver disease, like cirrhosis, and may also be seen in heart failure or diabetes. 3. Clubbing. Normal fingers have a gentle, flat curve at the tips. When you press two nails together, you'll see a tiny gap, a diamond-shaped space. In clubbing, the fingertips swell, and the nails curve more than usual. If you try the same test, the diamond shape disappears. This happens because chronic liver disease reduces oxygen levels in the blood. Over time, the body adapts by reshaping the fingertips to increase blood flow to the area. It's like when a road is widened to handle more traffic. Your fingers reshape themselves to compensate for the reduced oxygen. 4. Ascites. Swelling in the abdomen. Normally, your abdomen feels soft and there's no visible swelling. Even after a big meal, it quickly goes back to its usual size. In ascites, the abdomen becomes swollen and tight due to fluid buildup. You may notice your pants fitting tighter, or the swelling might even look like a pregnancy bump in severe cases. This occurs when the liver is so damaged that it can't regulate blood flow properly. Pressure builds in the veins, causing fluid to leak out into the abdominal cavity. Imagine ascites as water pipe that's clogged. The pressure builds up, and the water starts spilling out where it shouldn't. 5. Caput Medusae, visible belly veins. In a healthy individual, the veins on the abdomen are usually not visible, except in people with very thin or athletic builds. Caput Medusae refers to swollen, twisted veins that look like a network of blue or purple lines radiating from the belly button. It's called Caput Medusae because it resembles the snakes on Medusa's head in Greek mythology. When the liver is scarred, a condition called cirrhosis, blood flow through the liver is blocked. The body tries to bypass the blockage by redirecting blood through smaller veins near the belly button. These veins then swell and become visible under the skin. Imagine this as a blocked highway. Cars or blood spill over into side streets, causing traffic jams or swelling in unexpected places. 6. Varices, swollen veins in the esophagus or stomach. In a healthy person, veins in the esophagus and stomach carry blood to and from the liver without any issues. They remain small and invisible. Varices are swollen veins in the esophagus or stomach that develop when liver damage blocks normal blood flow. These veins stretch and can burst, causing life-threatening bleeding. If you're vomiting blood or your stools are black and tarry, it might be due to varices. Think of varices as a water balloon being overfilled. The walls become thin and prone to bursting under pressure. 7th Palmar Erythema, red palms. In a healthy individual, the palms are usually a uniform skin tone without any unusual redness. Palmar erythema is when the palms, especially around the base of the fingers, become red and warm to the touch. The redness often spares the center of the palm. Liver damage causes hormonal imbalances, particularly in estrogen levels, which dilate blood vessels in the palms, making them appear red. Think of it as a spotlight shining on your palms, making the blood vessels more noticeable. 8. Spider nevi, spider-like blood vessels. Normal skin might show small, faint veins, but doesn't typically have clusters of tiny web-like blood vessels. Spider nevi are small, red spots with thin blood vessels radiating outward, resembling a spider's web. They often appear on the face, chest, or arms. These are caused by excess estrogen due to liver dysfunction, which makes blood vessels more visible. It's like turning on a highlighter over certain areas of your skin, making the tiniest details stand out. 9. Muscle wasting. In a healthy person, muscle mass remains stable as long as they are eating and staying active. In liver disease, the body breaks down muscle for energy, particularly in areas like the shoulders, arms, and temples. This leads to a sunken or frail appearance. The liver stores and releases nutrients to fuel your body. When it's damaged, it can't supply energy efficiently, forcing your body to rely on muscle for fuel. It's like using the bricks from your house to keep a fire going. Eventually, the house starts to fall apart. 10th. Dupuytren's contracture, bent fingers. In healthy hands, fingers extend and flex freely without restriction. This condition causes the fingers, particularly the ring and pinky fingers, to bend toward the palm and become difficult to straighten. In liver disease, especially alcohol-related cases, certain substances build up in the body and affect the connective tissue in the hand, leading to tightening. Think of a rubber band that gets overstretched and then stuck in a bent position. It's hard to snap it back. 11th, hepatic encephalopathy, confusion. A healthy liver filters toxins from the blood, preventing them from reaching the brain. When the liver fails to filter toxins, they accumulate in the brain, causing symptoms like confusion, forgetfulness, and even personality changes. The buildup of ammonia and other toxins disrupts brain function. This can range from mild forgetfulness to severe disorientation or coma. Imagine trying to run a computer with too many apps open. It slows down, crashes, or behaves erratically. 12th, jaundice, yellowing of skin and eyes. Normal skin and eyes have a consistent tone without any yellowing. Jaundice is when the skin and whites of the eyes turn yellow due to a buildup of bilirubin, a yellow pigment produced when red blood cells are broken down. When the liver is damaged, it can't filter out bilirubin properly, causing it to accumulate in the blood. Think of a factory that stops processing waste. The garbage piles up, and the whole area starts to look and feel different. 13. Easy bruising. A healthy liver produces proteins that help your blood clot when you get injured, preventing excessive bruising. In liver disease, the lack of clotting proteins causes frequent or severe bruising, even from minor bumps. It's like trying to seal a leak without enough tape. The damage keeps spreading. Prevention of liver disease. While some liver diseases are genetic or unavoidable, many can be prevented or managed with the right lifestyle choices. Here's how you can protect your liver. 1. Maintain a healthy diet. Focus on a diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats. Avoid excessive consumption of processed foods, sugar, and unhealthy fats, as these can contribute to fatty liver disease. Limit alcohol intake, as excessive drinking is a leading cause of liver damage. 2. Exercise regularly. Regular physical activity helps maintain a healthy weight, reduces fat accumulation in the liver, and improves overall liver health. Aim for at least 30 minutes of moderate exercise most days of the week. 3. Avoid toxins. Limit exposure to harmful chemicals found in cleaning products, pesticides, and certain medications. Your liver works hard to filter out toxins, so reducing your exposure gives it less to handle. 4. Get vaccinated. Vaccinations for hepatitis A and B are essential to protect against these viral infections that can cause liver inflammation and long-term damage. 5. Avoid sharing needles or personal items. Hepatitis C can spread through contaminated needles or personal items like razors and toothbrushes. Be cautious to reduce the risk of transmission. 6. Regular health checkups. Get routine blood tests to monitor liver function, especially if you have risk factors like obesity, diabetes, or a family history of liver disease. 7. Be cautious with medications and supplements. Follow dosing instructions carefully and avoid mixing medications with alcohol. Some over-the-counter drugs and supplements can be toxic to the liver if taken improperly. 8. Stay hydrated. Drinking plenty of water helps the liver function efficiently by flushing out toxins and keeping the body balanced. Your liver is a remarkable organ with the ability to regenerate and heal itself, but it's not invincible. Understanding the signs of liver disease and taking proactive steps toward prevention can make a world of difference. If you notice any of the warning signs we've discussed, don't ignore them. Seek medical attention as early as possible. Your health is worth the effort. Remember, a healthy lifestyle isn't just about avoiding disease. It's about thriving and living your best life. Protect your liver, and it will take care of you for years to come. Thank you for watching, and if you found this information helpful, please like, share, and subscribe for more health tips and insights. Stay healthy, and I'll see you in the next video.